Hello, this is Suzette Arrindell, and this video presentation is in partial fulfillment of Nursing N5340 Management Seminar. And I have here with me today Barbara Tree, who is going to give us a short presentation on certification. Thank you very much, Barbara, for doing this video for us. And if you can give us your presentation regarding certification, that would be great.
Yes, I'd be glad to. Suzette has asked me to come today and talk to you a little bit about certification and what certification is about and how that differs from licensure. Well, certification is really nothing new for consumers. If you are going to buy a particularly good piece of meat to put out on the July 4th grill, you might look for some USDA certified meat. If you want to make sure your taxes are done correctly, you might take your taxes to a certified public accountant. You might look for a mechanic who is certified to repair your car. And of course, if you have important mail, that's likely to be sent certified. Well, so why do we do this? Why does the consumer look for certification and use certification? Well, certification ensures that the product or the service that the consumer is about to get is going to be exceptional. It ensures that consumer that there's going to be a certain quality, a certain level of product or service that for sure that consumer can expect when they purchase that product or service. So if you think about it, if you were a patient and going into the hospital, wouldn't you like to know if there was some way to know that your nurse has a certain level of skill, knowledge, ability, experience? Wouldn't it be great that you knew whether that nurse was your day nurse or your night nurse or your weekend nurse, that you could expect that same high level of care? Healthcare consumers are very knowledgeable today that hospitals are looking at ways to cut costs. So we really have an obligation to our healthcare consumers to help them know that the nurses that are caring for them can provide them a very high level of care. So what's the difference between licensure and certification? Well, licensure is the entry level of practice. It's regulated by a government agency. It's regulated by a lot of laws, and it provides the legal authority for a nurse to practice nursing. So what an RN license does is it assures the healthcare consumer that that nurse has met certain minimum qualifications and with some orientation should be able to deliver a safe level of care. The problem with that is in healthcare today, our patients are sicker than ever before. Their care is more complex than ever before. And we as nurses have to continually engage in a great body of knowledge as regards care and how best to deliver care. So parents, families, and patients have the right to know that their nurse is not just a safe nurse, but a nurse who's up to date and is credentialed in the specialty of care that they find themselves. So how does licensure differ from certification? Well, licensure is a voluntary process, and it's a process that's governed by a non-governmental agency, and it validates the nurse's competency and qualification to practice in a certain clinical area. So it's formal recognition of a nurse's skills, experience, and ability, and it's set at a level by her professional association. So the professional association sets forth standards that say if these standards are met, we can expect optimal health outcomes for our patients. So certification validates this specialty knowledge and experience beyond a minimal level. It's definitely a mark of excellence for the nurse. So licensure then provides that legal authority, that minimum safe level of care, but certification reflects an achievement of a higher level that's been set by their professional organization beyond that of simple licensure. It validates that a nurse has knowledge, skills, and abilities and experience beyond the scope of her license. And as a voluntary process, specialty certification really says to the consumer that this nurse is committed to professional development, to her career development, and certainly has dedication to patient care. And both of these are very important in healthcare environment that's constantly changing. So, how does certification benefit a nurse? Well, by becoming certified, the nurse validates her expert knowledge and skill, and so she positions herself in a good place for recognition by her current employer, as well as sets her above other nurses for any future employment opportunities. It also gives a nurse a sense of confidence that her skills, her knowledge, her judgment are based on a higher level that comes from her professional association rather than a minimal level that's going to be set forth by the licensing agency. Certification is going to increase her job satisfaction, as it's been shown to increase the professionalism of the environment of the practice setting. And certified nurses, thus, are more apt to stay on their units, and staff retention is much more compliant in these types of units. So how does certification benefit patients and families? Well, it ensures the patient and the family that the nurse's practice is consistent with established standards and is excellent from their professional association. It says to that consumer that the nurse is qualified, competent, and has met rigorous requirements to achieve extra credentials for specialty care. So how does certification benefit employers? Well, nursing certification and the continuing education required to maintain it contributes to the creation of an environment of professionalism, and that contributes to retention of staff. Hospitals that have been shown to support and recognize certification have been shown to increase nurses' job satisfaction, and that's very essential to recruitment and retention. Certification is also a vehicle for hospitals to differentiate themselves from their competitors and demonstrate that they have attracted the best, the most qualified, the most skilled, and the most experienced nursing professionals to their organization. And hospitals that are seeking the Excellence in Recognition Award through ANSSC Magnet Program have to have a designated number of certified staff working on their units. So then, once you decide to be certified, how do you prepare for certification? Well, the first thing, of course, is to find the accrediting agency for your nursing specialty. And once you find that, locate their website, and you're going to want to download a blueprint of their exam. The test is going to be broken down by content area, and each area will have a certain percentage attributed to it, and that's the percentage the nurse can expect to find on the test in terms of numbers of questions. So review that test outline and determine what areas you know and what areas you need to do more review on. And there's often practice questions on the website as well, so that you can help assess your own learning needs. A second thing to do is to form a study group. This allows you as a group of nurses to pool study resources such as review books or study outlines. Next, make a study calendar with your book, or with your group rather, and stick to it. Divide the exam content between members in the group, and then each group can study up on that particular piece and send it back to the rest of the group. And then most importantly, set a date to take the exam with your group. This is going to keep you accountable and on target for studying as well as for taking the exam. A lot of nurses go to a review course for certification. Just be aware that a review course is designed really to help you identify your study need and point you to resources. There's no way in a couple days of a review course that you're going to learn everything that you need to know to take the exam. Remember, certification is about your years of experience as well as your knowledge base. And lastly, I'd suggest you talk with other certified nurses. What resources and tools did they use to prepare? What study tips can they offer you? What was their experience with the exam? They know what you're going through, and they can offer you a lot of support and encouragement. So as healthcare becomes more complex, it's becoming increasingly vital that the public knows that the professionals taking care of them are more than just minimally competent, but in fact can deliver excellent care. Certification is an important indicator to our patients and our hospitals and employers that a nurse is qualified and competent in specialty areas and has met rigorous requirements to meet this expert credentialing. Everyone in the healthcare equation benefits from certification, whether that's a patient, an employer, a nurse, because certification is a mark of excellence. Nurses and employers have a shared obligation to honor the public's trust in assuring competent nursing care, and we can do that through certification. Thank you so much.
Thank you very much, Barbara, for that excellent presentation. If anybody has any questions, feel free to give either myself or one of my peers a call or an email if you should need some further information regarding certification. Thank you very much, Barbara.